You just had the biggest transaction in the history of the company, $30 billion acquisition you made of a Swiss company, Actelion. Tell us about why that was strategically important for Johnson & Johnson. Does it change your direction?
Well, David, really it's a continuation of the direction and the path that we've been on over the last 5 years. Look, we're incredibly proud of the performance that we've had as a company. We've been able to grow faster than the markets in which we compete. Our pharmaceutical sector in particular has done really well. I mean, launching about 15 compounds over the last 6 or 7 years. Many have been transformed into billion-dollar blockbusters, but even more importantly, really making a difference for patients. And as we looked at different areas where were there great opportunities in terms of unmet medical need, where were there companies that we thought we could actually add to synergistically to help performance at Johnson & Johnson, but also at that company, and Actelion was a great opportunity for us.
So Alex, you've seen this, I've seen this over the years. When transactions like this fail, it's not because of the finances, it's not because of the strategy, it's because of culture. Culture is typically the thing that gets in the way. How are you going to meld these cultures?
Well, David, you really hit the nail on the head. When we take a look at different opportunities, of course, we're always trying to say, where is there unmet need? Where can we go in and really create value? Where's there an opportunity perhaps to be synergistic with some of our existing compounds based on a therapeutic area or other capabilities? But what's really important is culture. And at Johnson & Johnson, whether you look at a 50, a 35, a 25, or a 10-year time frame, we've got a great track record of integrating companies in around our credo-based culture. And in fact, what we find is while the products certainly are important to be adding to our portfolio, as important are the people, the culture that we bring in. A great example of that, in fact, is Dominic Caruso, our current CFO. We actually acquired Dominic as part of the Centocor acquisition many years ago. So that's a critical element and something that you absolutely have got to get right to make sure that the acquisition's a success.
So where is Johnson & Johnson headed strategically at this point in terms of acquisitions as well as dispositions? What are you going to be 10 years from now? What are you going to be more in and less in? I'll note, for example, I think you weren't even in oncology at all 10 years ago. So that was a major shift.
Absolutely. And look, we believe in our diversified model. We think our diversified model, in fact, has been a major reason for our performance. If you look financially over the past 15, 10, 5 years, we've been able to exceed most of the major indices. And a major reason for that is when one of your businesses was challenged. By having a diverse portfolio, it enabled us to reinvest, to bring about the innovation, and to overall get the corporation on a growth trend. Our pharmaceutical group in particular, I mean, if you think back about 8 years ago, we went through about an $8.5 billion patent expiry period. And instead of going out and doing a very large acquisition, which can be extremely challenging, as you noted earlier, we continue to invest in our own R&D. We launched a lot of new compounds, and now our pharmaceutical division is ranked in the top 5 pharma companies. Areas like oncology have been a huge driver of that growth. It starts with compounds that really make a difference for patients, things like Darzalex and Imbruvica and multiple myeloma and lymphoma and other areas. But then, frankly, a lot of great commercial and R&D expertise being applied. So we're really satisfied and are pleased with the 5 therapeutic areas, now the 6th with the addition of Actelion. And we're going to continue to look for compounds in those areas that really make a difference and drive our business.
So you've mentioned pharmaceuticals a couple of times. Let's talk about a couple of specific drugs. First of all, Darzalex. You have a new ruling on Darzalex. How important is that to you?
We couldn't be more excited than the compound Darzalex. I mean, if you look at the data in multiple myeloma, and look, this is a really difficult condition. Unfortunately, too many of us probably know somebody who's died of multiple myeloma. And if you look at the difference that this compound has made, and the recent data showing that it can be used even earlier, that's one of the keys. Yes, you have to get a drug approved with a certain amount of data, but then it's the ongoing investment that we're making. In fact, these are not products in and of themselves. It's almost a pipeline within a product as you're able to explore it in different areas. And we're particularly excited in oncology, where we're finding new combinations of products, as we gather more information, could offer even more hope for patients.
Johnson & Johnson is a very big company. As I said, something like $75 billion in revenue this year. How material could something like Darzalex be to your overall revenue picture and your bottom line?
We believe Darzalex could be a very substantial impact on Johnson & Johnson going forward. In fact, just a couple of weeks ago, we held a large investor relations day where we featured our pharmaceutical business. And we were able to take everyone through the pipeline, the near-term opportunities. And by the way, we think products like Darzalex with all these new indications will in fact be bigger than many other new product launches that you might see in other companies. And we're continuing to invest in that area. We've got a great team of researchers, people like Paul Stoffels, Bill Hite, Peter Leibovitz, others that have a very strong core competency. And then of course the other thing is we are always looking for additional compounds to add to our portfolio. And I think our track record of being able to identify early science and then bring that in, apply our clinical and our regulatory and our commercial expertise, it's really been an example of our success.
On the other hand, Remicade has been very, very important to you, and now you have a biosimilar from a competitor that's out. You're starting to see some decline, as I understand it, in that business. What do you anticipate? What's the path that you see for Remicade over the next 3 to 5 years?
Well, you're right. We've been incredibly proud of the performance of Remicade through many years. And we understand the role of biosimilars, of generics in the marketplace. That's one of the reasons why if you're a company like Johnson & Johnson, we're investing more than $9 billion every year in research and development. We know that we need to replace those compounds, and ultimately the only way we can continue to be rewarded is if you have an outlet like biosimilars. Now, it's important that they follow the right IP process, that provide the right kind of clinical data. But I think what we've shown with Remicade is that biosimilars are not generics. They're not exact replicates of the compounds. I think we've demonstrated that we've got a broad portfolio of other compounds in this area, and these products are also not interchangeable. And I think if you combine that with the strategies that we have in place, we think that we're going to manage it well. And we couldn't be more excited about our immunology portfolio with compounds like guselkumab, sirukumab, others that will be launching in the very near term.
So 5 years out, do you expect Remicade still to be a significant player for Johnson & Johnson, even if diminished?
We would expect it to diminish, but that's why we continue to invest, because we're even more excited about the additional compounds that we're going to launch between now. In fact, we expect between now and 2021 to have over 11 compounds submitted, and all of which could have over $1 billion potential. So we're quite excited.
A lot of capital investment too.
It is.
Those don't come cheap.
No, they don't. But what, we think that investment has been a smart one on our part and for our investors.
Well, Alex, you must have spent some time taking a look at what's going on down at Capitol Hill. If the Senate bill became law, how would it change the healthcare industry?
Well, David, first of all, I would maybe pull it up just a little bit. And, our thinking is that it's representative of this major challenge that we have of how do we provide high quality health care in a sustainable way. And, we've been talking about this for a number of years, and whether it was with the Affordable Care Act, or actually prior to the Affordable Care Act, or what we're seeing now, it's this challenge of demographics here in the United States, of costs, and you see it around the world. And so, look, I still think that we've got a lot of slicing and dicing to do. And it's our hope that we find some kind of bipartisan approach. And I would also say that likely for the next 10 or 20 years, this is something that we're going to have to be working on because it's so important.
Well, you said the critical word, sustainable. If you look at Obamacare, you look at the House version of the bill, you look at the Senate version of the bill, do any of those realistically promise that we will bend the cost curve? Because we now have, what, 17% of GDP, something like that, on healthcare. It can't keep growing.
Right, it's really critical. And look, and by the way, we're just entering the critical phase when you look at demographics, the number of people who are 65 and older. So even if you hold some of the pricing, the sheer increase in demand based upon a population going from 12 to about 25% of our population over the age of 65, and when you turn 65, you consume about 5 to 7 times the amount of health care that you do before. So you're right. I think it's about how do we get that right balanced and making sure that we're effective, that we're efficient. It's 20% of our economy. But at the same time, how do we make sure we continue to reward innovation? How do we make sure that we don't compromise quality of care for so many of these patients who are depending on it?
What happens if those people either can't afford supplemental insurance, or they get kicked off of, say, Medicaid or something, or Medicare becomes a little less generous? Then that does affect you, right?
Absolutely, and that's why it's important to get this part of the bill right. And look, it's our hope that by working across a number of the different parameters that they're working on right now, what about the subsidies? What about tax credits? What about the different qualifications? How do you provide perhaps a little bit more flexibility at the state level? When you're talking about the amount of dollars that we are, when you're talking about 20%, then we know that there are areas that we can do a better job, and it's going to be critical to focus on those areas.
So that's obviously one area you're paying attention to in D.C., but the other is really tax reform. And I'm interested, if you repatriated all the money you had overseas, A, would you, if you got a cut? And B, what's the order of priority? Buybacks, dividends, CapEx?
Well, look, I would start, first of all, tax reform is actually critical for us. For us to, frankly, get rid of some of the anomalies that are causing things, I think other things in the way companies are thinking about, where they're going to be based. For us to be more competitive on a global basis, it's essential that it gets done. We're working very hard with them. And, as we think, our capital allocation strategy is really focused on what our strategy is. And so, tax schemes can change over a period of time. But if you look at J&J, whether it's been at frankly, a 25, a 10, a 5-year period, we look first at dividends because we know our investors are depending on us for that. And that's after, of course, we've invested in the business in the right way, which we do. For example, over $9 billion in research and development. And then we make sure that, after that we're always on the look for new technologies that we can acquire. About 50% of our innovation we source externally. And then we look at other things like, what about buybacks, to make sure that we're making smart use of that. And of course, when we do those acquisitions, we try to make sure that we're doing them in an appropriate and a tax-efficient way as well.
Alex, you say tax reform is critical. Explain to us how that is. For a couple numbers, I think your effective tax rate is something just over 20%. Roughly, yes. Okay? So if the tax rate comes down to 28 or 25%, does that change Johnson & Johnson at all?
Well, David, the more important issue for us is really the flexibility that it gives you to your capital deployment. And what you want to make sure is that companies are making investments based on the inherent value of the investment, not on the particular tax scheme. And, so things such as inversions, well, a lot of that's taking place because companies and many times are being rational based on the tax rate that they can be. And so for, another example for us would be how competitive you are on a particular acquisition. If a company coming out of Europe can pay a much lower tax rate versus us, it may preclude us from being able to acquire great technology for the future.
Are there instances where Johnson & Johnson was put at a substantial competitive disadvantage because of tax rates in terms of acquiring other entities?
Well, we've been fortunate based upon the targets we have. We haven't seen it be a very significant issue to date, but it does concern us, as you see some of these gaps widen. And again, we like to have a system such as territoriality, where not only do we have a more competitive rate, but frankly, where you have more flexibility, more mobility to ultimately deploy that capital in the most efficient way possible.
So just to sum it all up for me, is that it's not necessarily the absolute level of the tax cut that you get in D.C., it's the fact that you get something done which makes you more competitive overseas.
Yes.
Okay. I wanted to get your take before you go on the labor market, because we talk all the time about how the labor market's tight, but we're not seeing a big rise in wages. In your industry and in your company, how tight do you see the labor market being? Well,
the labor market in our industry is always tight because when you think about the educational background, the training, the capabilities, it's clearly a lot in science and STEM. So we're always competing for the very best scientists, the very best commercial, marketing talent in the world. Fortunately, people find Johnson & Johnson attractive for a lot of different reasons. The company culture, as well as the career opportunities that we represent. But we find it that we're still able to attract the very best talent. But like everybody else, we're always competing.
How would you describe your unit labor costs? Rising more quickly than before, stable,
I think
falling?
They're fairly we've seen it to be fairly stable. But it depends. In certain categories, of course, it can be somewhat higher. But overall, we've seen it to be fairly stable over the last several years.
And finally, Alex, I don't want to let you go without talking about this Health for Humanity report that you just brought up from Johnson & Johnson. At a time when we see the administration in Washington apparently retrenching, particularly on environmental restrictions, for example, maybe some other things as well, can the private sector step in, and should it step in, to try to advance some of those interests that the government had been doing?
Well, I think that you're seeing change in these areas happen regardless of what happens in the government. And look, at Johnson & Johnson, we have over a 75-year commitment vis-a-vis our credo. to make sure that we're always doing what's best for patients, for the moms and dads that use our products, for our employees. You know, we find that by having progressive policy such as family leave of up to 16 or 17 weeks for men, for women, that's, you know, to your earlier question, that's what allows us to attract them, focusing on health and wellness. But in areas like the environment, there too, we think we've got a very strong track record. And look, we've set ambitious goals. We're going to already reduce, you know, our utilization of resources by about 35% by 2020. We want to go to 80 to 100% by 2050. So we're putting those things in place because not only do we think they're the right thing to do, but we think, frankly, it's good business for us as well.